The budget for the Idaho Department of Health and Welfare has hit a new record of $5.5 billion and would give Idahoans a bit more than what they bargained for. Keep in mind that big spending allows woke spending to flourish. The Idaho Department of Health and Welfare's budget is bursting at the seams with endless Medicaid spending, while entitlements and woke programs continue to filter through the Division of Public Health. Meanwhile, the department is starting to take additional heat for funding programs at medical schools designed to teach future physicians about woke ideals that harm Idaho's youth. The budget for the Division of Medicaid has grown out of control since the start of Medicaid expansion. Since 2020, when expansion was launched, the budget has grown nearly 38%, or $1.8 billion. For perspective on the cost of Medicaid expansion compared to other programs, the expansion plan has 82,000 fewer beneficiaries on the books than the basic plan, yet costs about $2,800 more per person. Fortunately, the federal government is rolling back the requirement to keep ineligible beneficiaries on the Medicaid rolls. This has the potential to remove approximately 150,000 people that shouldn't be receiving free government health care. This will hopefully stall the ever-increasing costs of the program, but will not be a permanent fix for the program. Though the Medicaid program draws most of the criticism, the Division of Public Health Services has been working as the bastion of woke spending at the Department of Health and Welfare. Among the most wasteful initiatives, the division will offer free polio immunizations for Ukrainian refugees resettled in Idaho at the tune of more than $532,000. Director Jepsen was unable to answer the question in JFAC, but the number of Idaho refugees, as estimated by the Idaho Office for Refugees, is about 260 Ukrainians resettled here in the Gem State. This equates to a cost of $2,047 per person. Why the high cost? In addition to acquiring the vaccines, the department intends to use the funds to upgrade the Idaho vaccine database to keep records of who received these vaccinations. Pandemic spending at the behest of the feds has also been the focus of the department. The division also is asking for a $38 million federal funds increase to support pandemic response training, vaccinations, virus testing, and staff for the COVID response. Almost $6 million of this money will come in the form of mini grants for groups ranging from schools to daycare centers. Essentially, this is the division's way of handing out free taxpayer money for anyone who wants it. Woke spending is also pervasive. The Division of Public Health's Physical Health Services has spent more than $104,000 to fund pride events in the form of smoking cessation grants. When questioned about this, Director Jepsen conflated pride events with sponsorships at rodeos and races. A hard comparison to make, being that rodeos and races aren't known for hosting children's drag shows. The department is also in hot water for funding sex education curricula endorsed by Planned Parenthood. Director Jepsen noted that these programs had to be adopted by public school districts before they could be implemented. However, it is notable that he did not deny funding the materials in question. These programs circumvent requirements to teach abstinence-focused material. Overall, the Division of Public Health has become the hotbed for wokeism and waste in Idaho healthcare and are costing taxpayers a pretty penny. After a week of presentations from the Idaho Department of Health and Welfare, the University of Utah School of Medicine provided a preview for what to expect for Education Week starting Monday. Administrators from the University of Utah fielded a question from Senator Scott Herndon about their elective courses that promote advocacy for surgeries and hormone therapies for transgender adolescents. They are asked how many Idaho students participate in these courses and whether this is a studious way to spend taxpayer dollars. In turn, university administrators dodged the questions, citing that they will provide JFAC with a report on a later date and noted that their courses are currently, quote, under review. As we wrap up week 2 of JFAC and transition into Education Week, we'll be looking at the second largest budget group in the state, and many of the woke policies and concerns are likely to resurface. It is no secret that the Idaho Department of Health and Welfare's budget is bloated and faces the same problems inherent to all bureaucracies flush with excess tax dollars. they have to find new ways to spend it. This record-breaking budget, loaded with new line items and supplemental appropriations, has allowed government to grow and wokeism to flourish. Lawmakers are going to have to take a hard look at these budget requests and make cuts to government bloat to realign the budget with Idaho's values. Join us next week for another episode of Fiscal Fridays and more budget analyses at idahofreedom.org.